Hello, I'm Dr. Nancy Harthun, and this is a Society for Vascular Surgery briefing about the benefits of cholesterol-lowering medication for the health of vascular patients. Statins are a class of medications that lower the amount of cholesterol in the bloodstream. This type of drug was first isolated from fungi in the 1970s. These drugs all act as HMG-CoA reductase inhibitors, a key control point in the metabolism of serum cholesterol. These compounds were sought because of the known association of high cholesterol and cardiovascular events, including stroke and heart attack. Specifically, when bad, also known as low-density lipoprotein or LDL cholesterol, is high, the risk of heart attack and stroke is high. It was thought that these drugs would lower bad cholesterol, which would then lower the chance of these events. Over the intervening 40 years, this theory has been proven, and many studies have shown the benefits these drugs yield by lowering the risk of heart attack and strokes in persons at risk, particularly due to high cholesterol. Further research effort was then directed to accurately define more specific patient populations that would benefit the most from taking these medications. Patients with known cardiac disease were evaluated. Despite having known disease and not just the risk factor of high cholesterol, patients with previous heart attacks and interventions, including heart surgery and angioplasty with or without stents, benefited in survival and protection from future cardiac events by taking statins. Patients with other arterial diseases, but not heart disease, were also examined. Patients with atherosclerosis or hardening of the arteries in leg arteries and arteries supplying the brain also benefited from taking statins. Again, incidence of stroke and heart attack were lowered in patients taking these drugs when compared to placebo. Further testing showed that patients taking these drugs while undergoing surgery or intervention for cardiac or vascular problems had a noticeably lower rate of complications during the surgical time period. More recent research has suggested that statins promote regression of atherosclerotic plaque in leg arteries. Data also suggests that statins have effects beyond simply lowering the level of bad cholesterol in the bloodstream. These compounds stabilize atherosclerotic plaques, making sudden rupture that causes stroke and heart attack less likely. They also lessen inflammation within the artery by improving the function of cells that line the inside of the artery. This likely leads to a lower chance of sudden thrombosis of an artery affected with atherosclerosis. The number of adverse effects of statins have been recorded since their introduction 40 years ago, and they are infrequent. However, they can be severe, and it is important to know the potential downside of these drugs. In rare circumstances, statins can cause liver damage. This doesn't cause symptoms and is the reason frequent laboratory tests are ordered when use of a statin is begun. Statins can also cause a wide range of muscle injury. In its worst form, called myositis, rapid muscle destruction can lead to kidney failure. This side effect is also rare. Muscle pain and cramps are frequent and far less serious side effects of using statins. In summary, there are a myriad of good effects for patients with all types of atherosclerosis when they take statins. Side effects are relatively rare, and there are many varieties of statins currently available. This allows careful selection of the best individual statin for each patient.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.